Stephanie.
I'm Allie. I'm going to be your nurse today. How are you feeling?
I'm actually feeling pretty good. I know that I'm being put on a medication today, but I'm not really sure what it's for.
You're right. That's actually why I came in here. I have these pamphlets for you. The medication your doctor has prescribed is called warfarin or Coumadin. So have you ever, or are you ready to explore this medication?
Yeah, thanks for giving me these pamphlets. I mean, I always forget everything, so these will be really great.
Well, good. I'm glad they'll be helpful for you. Alright, so as I mentioned before, it's called warfarin or Coumadin. So do you have any idea what this drug is used for?
Well, I thought it was a blood thinner.
Well, it's actually an anticoagulant, which is just a fancy word for preventing blood clots. So since you have atrial fibrillation, you run the risk of getting blood clots because your heart might not get all the blood out and it will have some pooling left, and that can, with the pooling of the blood, clots can form. So the Coumadin just helps prevent the clot from forming.
Okay, well, I know I came in with chest pain and they told me that's related to my atrial fibrillation. So does this actually mean I'm at a higher risk for blood clots?
Well, you are at a higher risk, and this is a prevention drug, so it doesn't mean you have blood clots. This drug just helps prevent the clots from forming.
Okay.
So it's important to know the normal dose, which is 2 to 10 milligrams, and your doctor has prescribed 4 milligrams for you to take every day by mouth.
Okay, so it's just one pill I have to take, right?
That is right. Just one pill once a day at the same time every day. So it does take 36 to 72 hours for warfarin to actually come into effect, but since you have some IV warfarin going in right now, it will take effect sooner.
Okay.
However, if you ever stop this medication, it takes 2 to 5 days for the warfarin to get completely out of your system.
Well, is it something I'm going to be on forever, or why would I need to stop taking it?
Well, it is a lifelong prevention drug, but your doctor might have you stop taking it if, for instance, you ever need to go into surgery. They will discontinue the warfarin because it's really important for your blood to be able to clot so that you can heal.
And is that just me, or?
Well, it is a highly individualized drug because each person's different. So it's really important to get routine INR and PTT labs done, and these are just labs that measure the clotting time in your blood. So when you're taking this medication, there's some precautions that you need to follow.
Okay, well, I know that when I'm outside running around and doing activities that I can be bruised easier. I mean, are there other things that I need to watch out for?
Well, yes, bruising is definitely one of them, and also vitamin K has blood clot factors in it, so it's really important to maintain a really consistent diet with those foods. So things like spinach, Swiss chard, other green leafy vegetables like that. There's actually a list right there for you. Okay. So all those foods, it's really important that you maintain it really consistent throughout your diet, because if that fluctuates a lot, that will make the need for your dosage of Coumadin to fluctuate.
Okay.
So other things to worry about, avoiding alcohol, cranberry juice, pomegranate juice, and tobacco, and also NSAIDs like aspirin. These things all increase your risk of bleeding, so it's important to avoid those.
Okay.
So, are you aware of any possible side effects?
Well, I mean, the only one that I knew of was the bruising. What else should I look for?
Well, some common side effects are cramps, nausea, and fever, and those aren't too concerning. However, if you notice any increased bleeding, these are the side effects that you really need to contact your doctor right away. So if you notice increased bruising, bleeding gums, nosebleeds, black tarry stool, or any blood in your urine, you need to contact your doctor right away.
Okay, so I know I'll check my skin on a daily basis, and if I have any increased gum bleeding or anything like that, I'll make sure to contact my doctor for sure.
Okay, good. So some tips to decrease your risks of bleeding: if you use a soft toothbrush, an electric razor, and being really careful when handling sharp objects like scissors, knives, anything like that. Okay, so warfarin has some drug interactions with even over-the-counter drugs. So are there any over-the-counter drugs you're taking right now?
Well, I'm really not on any medication, except I do take aspirin every day. I think it's 81 milligrams, and I've been taking it for some time now. So is that something that I might need to change?
Well, I'll talk to your doctor, but the preventative measures that aspirin does are similar to what Coumadin does, and since aspirin does increase your risk of bleeding, he might change that. But
Okay.
I'll talk to him and let you know.
Okay.
Okay, so moving on to other concerns. Are you planning on getting pregnant anytime soon?
No, I have 2 kids already, and that's not in any plans, so.
Okay. Well, if those chances plan at all, or you have any unplanned pregnancies, make sure you contact your doctor, because the Coumadin can be harmful to your baby.
Okay.
Okay, so do you have any other questions about this medication?
I guess my only other question is, I really like cranberry juice. I've been drinking it every day for quite some time. Do you know the reason why I can't have it?
Well, there's actually something in cranberry juice called flavonoids, and this interacts with the medication and increases the risk for gastrointestinal or intestine bleeding, which can be fatal. So these cases are rare, but it's best to avoid it just to be safe.
Okay, well, thanks for answering my question. So I'll avoid cranberry juice from now on. I'll make sure to have a balanced diet with the vitamin K foods. And I won't drink alcohol, and now I know that my aspirin may change because of the Coumadin. And if I have any increased bruising or bleeding, I'll make sure to contact you guys.
All right, good. So just make sure you keep that pamphlet with you. It has all that information for you. And I'm also going to give you this Med Alert bracelet.
Mm-hmm.
It's important that you always wear that, because if there's any reason where you might become unconscious and get taken to the hospital, it's really important that they know that you're on Coumadin. So, all right, well, I'll talk to your doctor about our discussion, let you know what he says, and if you have any other questions, just let me know. I'll give you your call light so you can just hit that button and I'll come.
Okay, well, thanks, Allie.
All right. See you later.